According to the Division of Public Health, Delaware providers have now administered over 500,000 doses of the COVID-19 vaccine. With supply allocations on the rise across the United States and Delaware officially opening its vaccination program to all eligible Delawareans, efforts here in Wilmington remain focused on equitable distribution of the life-saving vaccine.
We have been, since late January, early February, doing targeted community events with community-based organizations, with faith-based organizations, community leaders, on very specific zip codes that we know are, by the CDC as defined as high social vulnerability.
According to the Centers for Disease Control and Prevention, social vulnerability refers to the potential negative effects on communities caused by external stresses on human health, such as disease outbreak, and in the case of the past year, the COVID-19 pandemic.
And then Newcastle County took over.
Lisa Henry is the Director of Community Health Services for the Delaware Division of Public Health. She says the CDC's Social Vulnerability Index has been a key aid in the state's efforts to identify specific communities that need targeted support. In the city of Wilmington, that support has been augmented by countless volunteers since the start of the pandemic, including the Wilmington COVID-19 Community Mobilization Group.
We're not seeing appreciably higher testing rates in the Hispanic population.
The COVID-19 Community Mobilization Group was really instrumental in helping look at the data and finding right locations to put pop-up testing sites and get outreach materials, inform our communication efforts. Are we saying things the way that they're going to be received and heard, not necessarily the way that marketing and communications always go out?
We've launched a social media messaging campaign, just utilizing our network to get the word out, if you will. We now have a pretty good ground team. Folks are going into communities that are tech deserts or communities where transportation is an issue, to help in getting not only the word out, but getting people to places where they can get tested and get vaccinated.
Dr. Henry Smith III has been a driving force behind the Wilmington COVID-19 Community Mobilization Group since it first formed last spring. He says the group began analyzing data on vaccination demographics from the Division of Public Health in late January, at which time the Black population in Wilmington was significantly trailing both the white and Latino populations.
These are communities that have suffered from every single social indicator: poverty, high unemployment. In many instances, we also have language barriers. And so these are communities that are really hurting. And these are communities deserving of and needing help. And so that's the business that we are in right now.
All right, here we go. 1, 2, 3.
COVID-19 has really opened our eyes to the needs for us to continue to work together as partners.
Dr. Marshala Lee first became aware of the mobilization group in 2020. Responsible for strengthening community partnerships in her role with Christiana Care, Lee says the group has been instrumental in addressing less tangible barriers to getting certain populations of Wilmington vaccinated.
There are a number of factors that feed into the history of mistrust among many minority communities. Ethically, we've built a lot of practices in place, so we're really working with our community partners to let them know about those safety measures that are in place and how to interpret the data so that they can really trust the information that's put out there and that they can trust the vaccine and its safety.
We can't do anything without incredibly strong partnerships. Because it's one thing if we start calling people, it's another thing if their pastor calls them, or if the leader of their community center calls them. And so really coming together as a community and saying, how do we focus on getting people in and helping them understand that it's safe and that the science is behind us.
We want to make sure that our communities that suffer the most, especially our Black and brown communities, have access to these vaccinations. Council members have been great in spreading the word about whenever there's an event happening inside their district, that they make sure they let constituents know as soon as possible.
Councilwoman Raishima Dixon and other members of Wilmington City Council have also joined in the local efforts of the COVID-19 working group. In a recent vaccination event hosted by Walmart, Dixon and her colleagues helped distribute vouchers to eligible residents from high-priority zip codes.
So they actually met in person and handed them by hand those vouchers. So they know those who are in need and have not gotten their chance to get the vaccination. And so they were able to provide that in person and identify who's in most need in this community.
Take a deep breath in and blow out.
Some that were a little uncertain about it, just the mere fact that I was on the front line encouraging them, communicating with them about the vaccination shot. It made them feel comfortable and at ease and wanted to come and get the vaccination shot. So I was really happy to be able to be involved and being a partner on a level where I can contribute and add value.
With the state's expansion and eligibility, Walmart says their goal is to provide more doses of the COVID-19 vaccine within their pharmacies throughout Delaware in the coming weeks. Meanwhile, the Delaware Division of Public Health and the Wilmington COVID-19 Community Mobilization Group are doubling down their efforts to ensure all Wilmingtonians will have access to the COVID-19 vaccine.
There's a lot of other things going on in people's lives right now, so we're trying to be more forefront and in neighborhoods, in communities, registering people to get vaccinations or bringing it to them.
Our newest initiative is the race to 100% vaccinations for all Delawareans. We're not likely to get to 100%, but we certainly want to make sure that the move is expeditious, that the move is fair, that the move is equitable.
Reporting from Wilmington, I'm Michaela Austin, 22 News.